Chair recognizes the gentlelady from Illinois, Ms. Schakowsky, 5 minutes for questions.
Thank you, Mr. Chairman. I want to say that we do have a serious crisis in this country when it comes to budget, and for me, it's the budget of the senior citizens. And right now, we have a retirement crisis. People cannot afford to retire in the United States of America. And I say this at a time that our country has never been richer. This is the richest country on the face of the earth, and per capita GDP has never been higher. But as we all know, that is so unequally distributed that ordinary Americans have not seen an increase in wages for the last 3 decades, and all of the growth has really gone to the top 1%. And now we have a situation where I think we all agree that the SGR has got to go. And as I said, when the Democrats were in the majority, we did exactly that. But this idea that we have to ask senior citizens who are absolutely struggling right now on this 50th anniversary of Medicare, one of the most successful programs we have ever seen. And undoubtedly, this pay-for that we're talking about would put additional burdens on seniors. $85,000, as Dr. Moon pointed out, is now a rich senior. Some proposals have talked about lowering these the income to $45,000, making seniors who make $45,000 considered rich enough to pay higher premiums. I say shame on us as a country that we can't afford to provide health care to our seniors and persons with disabilities. There are plenty of places to look. We just passed, what did we call it? The Tax Increase Prevention Act. Extenders, $45 billion unpaid for. As I said in my opening remarks, just earlier this month, the Republicans passed a bill to redefine full-time, and that cost $53 billion unpaid for. But now we're saying, in order for doctors to get what they deserve and continue to serve seniors, we're going to ask senior citizens to pay more. I find that repugnant. I'm sorry, my hair's on fire to say that we should go to the elderly and the disabled in our country. I agree that we have debt, but you know, projected federal spending for Medicare and Medicaid have fallen by almost $1 billion since 2010. And if we compare the CBO's August 2010 and the August 2004 baselines, Medicare spending in 2015 will be about $1,200 lower per person than expected in 2010. So we are adding incredible savings because of the reforms in the Affordable Care Act, et cetera, to lower the cost of Medicare. And now we're going to turn around and say the seniors in this country are just having to spend more in order to save future generations from debt. I say we have plenty of money. And if we don't start talking about reasonable revenue, as the President did last night in his State of the Union, then again, I say shame on us. And I hope the senior citizens and the people with disabilities are paying attention to this important debate.